Hi, I'm Tina Morris, perinatal nurse champion for Region 2, the 20 Northwest counties in North Carolina. Before this role, I have 30 years of experience in labor and delivery as a bedside nurse and educator. We are two of six nurses in North Carolina who get to do this great work that focuses on improving maternal health outcomes and promoting best practice. One of the ways that we are doing that is with the Respectful Care Initiative.
And I'm Kathleen Broomfield. I am the perinatal nurse champion for Region 5 in North Carolina, which is comprised of the 14 counties on the southeastern corridor of the state. I have also been a labor and delivery nurse and postpartum nurse. In fact, between Tina and I, we have over 50 years of experience.
Kathleen, that makes us really old.
Perhaps, but we've seen a thing or two, Tina.
Just a
So,
few.
so thanks for joining us for what we're calling Small Acts, Big Impact Conversation, which is a piece of North Carolina's Respectful Care Initiative.
Over the next 4 years, the Respectful Care Initiative will be rolled out across the state. At its heart, it's about how we care for patients and how we care for each other.
Yep. And that's why we're calling it respectful care instead of respectful maternity care, because it's more than clinical or patient oriented. It's human. It's how we listen, it's how we connect with our peers, and how we create meaningful moments in every interaction.
As part of this initiative, we're building a Respectful Care repository. It's a free, easy to access hub with educational resources designed to support the mission.
And that will include this series, again, called Small Acts, Big Impact, which is a set of short, thoughtful conversations where we can explore how changing moments can actually shape a culture.
This month, we're focusing on awareness. So, what do we mean by that?
Well, in the context of respectful care, awareness means tuning in to your own assumptions, to the lived experiences of your patients and your coworkers, and to the diversity that shapes each individual's journey.
It means recognizing that every person brings something uniquely valuable to the table. Their culture, background, beliefs, all of it impacts how they receive and respond to care, and it also impacts how we deliver that care.
I agree, Tina. And when we embrace those differences, we deepen our compassion. And that not only enhances the care that we give, but also the teamwork that we rely on.
Absolutely. So we're going to move on to a short video that really does talk about how this plays out.
Hey, what are you thinking about? No, really, what are you thinking about? In fact, how often do you even think about what you are thinking? Neuroscience tells us we have between 35 and 48 thoughts per minute, which translates to 50,000 to 70,000 thoughts per day. These thoughts guide our behaviors throughout the day, including choices about how we go to work, what we listen to on the radio, what are we going to have for lunch, who do we speak to on our way to lunch, etc. Perhaps what's most amazing is that these thoughts, as they guide our behaviors, do it without us even knowing it. In other words, we're often operating on cruise control. Sometimes that works out well. Other times, our thoughts can have negative and unintended consequences. And that's what we're going to spend the next few minutes exploring. Hi, I'm Dr. Brenda J. Allen, Professor of Communication and author of the book Difference Matters, Communicating Social Identity. As a professor of communication, looking at difference matters through my teaching, research, consultations, and engaging with others in a wide variety of contexts, I've been especially excited at the newer developments of looking at how our brains influence ways that we communicate. Implicit bias is a psychological term that refers to ways that our unconscious and automatic thoughts can influence our behaviors. Sometimes our unconscious thoughts are about other people. Now, we've been taught that some groups are superior and some are inferior, and those unconscious thoughts about those people can lead us to what I call thinking under the influence. When we are not aware that we're thinking under the influence, or TUI, we may make unfair decisions in favor of or against someone based only on their group identity because of stereotypes about their group. TUI, left unchecked, can inhibit including others, which can then deny us the richness that diversity brings to our lives. Research about implicit bias suggests that employers may be thinking under the influence when they look at resumes. For example, as they look at names, they may associate them with gender, race, nationality, and unconsciously make decisions for members of the dominant group and not for those for the non-dominant group. We can catch ourselves and others thinking under the influence by being mindful as we interact with others. We should pay attention to our thoughts and our feelings. We can be aware of when we realize that we've assumed something negative about somebody based on that person's identity. That's a sign of TUI. For example, I was once on a panel with a wheelchair user who has a hearing impairment. As she was presenting, she made several witty comments that had us all laughing. I realized that I was TUI because I assumed that she would have a gloom and doom attitude because of her disabilities. If we want to work and learn and live and play in places that are equitable, we must be aware of how we TUI. So let's keep the dialogue going about thinking under the influence.
Yeah, one of my takeaways is I think I have closer to 100,000 thoughts per day because of my ADHD.
Yep. Yeah, I can see that. Well, this video reminds us that thinking under the influence of past experiences, biases, or fear, those can quietly shape our decisions.
And as nurses, this starts early. Nursing school and orientation often train us to prioritize safety, which is critical, but it can lead us to some fear-based thinking.
Yep. And also, as we gain experience, we are sometimes relying on our intuition, which we're taught to. And trusting your
Mhm.
gut can be helpful, but it's still shaped by the situations we've seen, not necessarily by the full picture.
Yeah, a great example is non-hospital birth. For example, in a hospital setting, we tend to encounter the ones that didn't go as planned. So we carry that experience forward and might unintentionally dismiss that many home births go very beautifully.
Tina, that is a great point. And I don't know if you know that in the United States, now 1 in 50 births happens outside of a hospital. And not only that, but this rate has increased by about 40% in the last 20 years.
Wow, that really did surprise me. It's a reminder that we don't see what can be as important as what we do. Now, tell me, did this increase proportionately across all races and ethnicities?
Unfortunately, no, a higher percentage of women of color are choosing home births than white women.
So there appears to be more driving that decision than just seeking an alternative birth option.
Tina, that is interesting and a very good point. So before we wrap up, we'd like to leave you with a few reflection questions that you all can take back to your teams or even just sit with personally.
Yeah, so some of the things we'd like for you to think about is have you ever been taught something that you later discovered was really inaccurate? Or can you think of a time where your gut instinct actually led you astray? How does your experience influence how you teach or mentor others? And lastly, how can you change the moment?
And becoming aware of how we think and how those thoughts are influenced is a small act, but it can have a big impact.
It can.
Mhm.
We want to say thanks for joining us and really thank you for being part of this journey toward a more respectful care environment.
Yes. And until next time, stay curious and stay compassionate.